The World Health Organization is joining the chorus of voices sounding the alarm about a rare inflammatory syndrome affecting children, as New York's governor warns the public to expect more cases. ABC's Marcy Gonzalez joins us from home in Los Angeles with the latest concerns. Marcy, good morning.
Whit, good morning. We're hearing more stories of children who've battled this. One mother telling us her son was outside playing, feeling perfectly fine one day, and then the next, spiking a fever and showing other symptoms that fortunately doctors took seriously right away. This morning, intensifying concerns about that rare inflammatory syndrome in children linked to coronavirus. ABC News identifying at least 220 possible and confirmed cases in 20 states plus Washington, D.C. More than 100 of those cases in New York, where 3 children have died.
And that 100 cases, I'll wager that's going to only go up, and it's going to be much more widespread than anyone thinks. New
York City now joining the CDC in issuing urgent alerts about what's known as pediatric multi-system inflammatory syndrome, telling doctors to watch for patients with a fever of at least 100.4 degrees that lasts at least 24 hours, along with inflammation and multiple organ involvement in children who've been infected with or exposed to COVID-19 within 4 weeks of the start of symptoms. 7-year-old Levi's mother never knew he had COVID-19 until after his scare with this new syndrome. But the first grader coming down with a high, persistent fever and vomiting. His doctor recognizing the warning signs, admitting him to the hospital where his symptoms evolved.
He had the red eyes, the red lips, then it went to the stomach pains, and then all of a sudden he had pneumonia and had to be put on oxygen.
After a week at Beaumont Royal Oak Hospital in Michigan, Levi was discharged, his test coming back positive for COVID-19 antibodies.
And these children, for whatever reason, they have a response to the virus that is excessive, an immune response that is an overdrive. Once you recognize it quickly and intervene quickly, that you can reverse it quickly as well.
Levi's mother grateful to have her little boy healthy and back at home this morning.
If I would have waited any longer, could have been having a different discussion right now.
And there are still so many questions about this syndrome, which is why Levi's doctor says it is so important for parents to stay vigilant. And if their child starts showing some of these symptoms, not to waste any time calling their doctor. Dan?
Marcy, thank you. So much valuable information there. So many of us have so many questions about this, as Marcy said, especially those of us who have kids. So let's bring in Dr. Todd Ellerin. He's an ABC News medical contributor and infectious diseases physician. Todd, good morning to you. The World Health Organization is just out with a new brief on this condition just hours ago. They say they don't know how many kids have gotten sick or whether there have been cases outside of the U.S. and Europe. They don't even know for sure, they say, that this syndrome is 100% linked to COVID. So with so many open questions, how concerned should parents be?
Well, good morning, Dan. I think it's important to recognize this is rare, so parents and children should not worry, but we do want to be able to recognize it. Think about inflammation, high fevers, red eye, diarrhea, rash that may be red or blue. In constellation, then we have to be concerned and you want to call the pediatrician. But in isolation, any of these symptoms, unlikely to be this mysterious syndrome. And it's reportable now. That's important because we're going to learn more about it.
I found it reassuring to hear that doctor in Michigan, in Marcy's piece, say that if you catch it early, you can treat it. Does that sound right to you?
Most kids, as serious as this sounds, most kids do well with this still.
Really, really reassuring to hear that. Let's turn now to the search for a vaccine. It takes a long time to develop one, but the Trump administration says it's hopeful they'll have one by January. As far as I know, the quickest we've ever had a vaccine developed in history is 4 years. So how realistic is January in your view?
Okay, so if the question is, are we going to get injected by January of next year, that's very unlikely. But I will tell you, I believe by January we'll be further along than we've ever been in vaccine development. And one thing to look at is the FDA just gave the green light for one of the companies in the U.S. that's manufacturing vaccines to go from the phase 1, that safety phase, to phase 2, which is a larger safety phase. Instead of looking at less than 50 patients, they're going to now inject 600 patients. Look for that safety signal and then immune response. So we're moving along rapidly.
So we may not hit January, but things are proceeding at a rather quick pace. Dr. Ellerin, always appreciate your analysis. Thank you so much for getting up with us this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.